comments about being a hot topic, and I would suggest it's a hot topic for three reasons, which are: one is what older people say, secondly it's the scale of it, and the third is the impact. So interestingly, although this is now such a hot topic and it's so great to be invited to the community committees, in Leeds it's been a hot topic for quite some time, and if you actually go back over several years, we've been trying to focus on learners in isolation through things like neighbour networks and other work. And quite simply, the reason why it was a hot topic is in pretty much every discussion, consultation we did with older people over years and years, the whole issue of loneliness was rising up the agenda as being a problem. And so for some time we know that we needed to do something about it. So it's really positive now that that hot topic's been picked up, not just by things like community committees and the organisations here, but things like people who have seen the campaign in the Yorkshire Evening Post. And the second reason is the scale. It's a bit too detailed for this meeting, and I partly use bits of this presentation to make sure it does stay on the agenda across organisations. This is particularly around older people, and I have a bit of bias there because of the ageing well law, but I would point out loneliness and isolation is also a significant issue for many others in the population. It's an issue for some younger people, it's certainly an issue for people with mild learning disabilities living in the community, and we know it's an issue for people with mental health problems. But I think there's some interesting learning, of course, from the older people's agenda, but also within the older people's agenda we can pick up some of the ambitions that are happening elsewhere in the city and other groups. So in terms of the older people, there's around 30,000 people who are socially isolated. What we're doing is some work with public health and the university to get this sort of city-wide figure actually down to a neighbourhood level and indeed street level. And we think once we've got that, we'll be able to do some real detailed, focused work on where we put our energy. But the other main reason is the impact. And this is from work Joseph Rowntree Foundation did across all groups. I won't read the thing out because I've only got a few minutes to do this. But it's a reminder that loneliness is a feeling. Social isolation might be the state you're in, but actually it's how you feel about that. So there will be some people who are not particularly social isolated, have got, really quite neighbours, but feel lonely. I've known of people being fairly lonely in a care home and they're not socially isolated. But you can also have that the other way round, that people can live social lives and be fine. Your problem is though when that loneliness starts to impact on your life, and that's the major problem. And what starts to happen there, I would argue, is these three things. And these are fairly bold statements, but they're backed up by the evidence of Joseph Rowntree and certainly our experience in Leeds. The first of which, loneliness kills people and it kills communities. Recent research done through the health service and working with public health, being isolated, being lonely, and the impact of that is probably equivalent to smoking about 15 cigarettes a day. That's the negative impact it has on your health and well-being. Well, that's clearly a major issue. But also, of course, loneliness kills communities. If you have a community full of single, isolated people who are lonely, they themselves are not contributing as well as their own health. And that's particularly a problem because the solution to loneliness lies within communities. So if we don't intervene now and soon, you get that snowball rolling. And I love the fact that Leeds has got an ambition to be the best city in the UK. As a Leeds lad, I think that's fantastic. But for me, being the best city in the UK isn't having the Leeds Arena or Harvey Nicks. Premiership football team would be nice. But loneliness itself is the problem. For me, the best city is being visited most, knowing your neighbours, knowing you're safe in your community. And I suppose a radical thing for somebody who works for social care today is that regulation kills kindness and social action. You do not solve loneliness by a social worker coming round. He's not going to sort it. I think social care is part of the solution, but certainly it's not the sort of thing we can do on their own. And I would even argue going down a very restrictive road, paid staff all the time, even if things like CRB checks for every single little thing doesn't work either. It's about what communities and the idea of neighbourliness, and you can't legislate neighbourliness. But also to remember the impact of this is that lonely people are vulnerable people. For us in social care, it's a safeguarding issue that we know criminals deliberately target lonely and isolated people again and again and again. So it's critical that we sort that out from that perspective. And finally, the more selfish social care thing is it has a direct impact on social care and health services. We know from talking to GPs that a significant amount of people they see just come again and again, because it's the only person they know they can get to speak to, and they keep on coming back. We know people turn up to A&E sometimes when they don't need that much medical intervention. This is a bit of an indictment on society. It's not a Leeds figure, it's a national figure. Fear and loneliness is the third biggest reason people think about going into a care home, and I think that's a terrible thing, because we should be doing something about that. So if we can solve loneliness, we actually help the entire health and wellbeing system. And we're suggesting there's three broad areas, which is about building community capacity, investing, because this stuff isn't free, it's cost effective, it's not free in social capital, and crucial, and that's why it's such a good mix here, is important, everybody's business. So I'll just pick up on those. So community capacity, it's a bit of jargon, sorry about that, but it's about a broad range of approaches that sustain that strong supporting communities, that then allow the strength within that communities to be the solution itself. And that's what we're attempting to do. So it's really good that a community committee sees this as a priority. And I've on my slide, this is the only one I'm going to read out in detail, because it's the most important one. It's a quote, I'm sorry, it's from an American. It's a guy who invented time banking. And what he's saying is, no society has the money to buy at market prices what it takes to raise children, to make a neighbourhood safe, to care for the elderly, make democracy work, or address systematic injustice. The only way the world's going to address social problems is by enlisting the very people who are now classified as clients and consumers, service users in our case, and converting them into co-workers, partners and rebuilders of the core economy. And the reason why I say that's so important is for two things. One of which is clearly saying that actually the solution, because it lies in communities, is to some extent a much more effective way than doing it than trying to regulate and trying to commission everything, or the council trying to provide the solution to everything. The solution lies in communities. But more importantly than that, it's shifting this idea about people who receive support, people are lonely and isolated, those groups of people are just passive recipients of services. What this model says that actually having older people is a great thing if you can harness that. If you have people with that skill and that knowledge in communities, let's harness that and actually make people the solution of the problems. And if you look at things like neighbourhood networks, it's fantastic to see that they're run and in effect owned by older people, that they're the volunteers, they're the management committee as well as the service users. And what this model does is take that further. So the fantastic neighbourhood networks, I don't know where we would be if these hadn't been evolved over the last 20 odd years. They are the jewel in the crown of early intervention and prevention. They are the envy now of virtually every city, urban environment in the country, if not Europe. We constantly get referenced in national documents. Those people working in the neighbourhood networks would be used to me ringing up as another minister wants to come, or on Friday we have people from Glasgow and Edinburgh came. And the reason why they become so important is, first and foremost, they were commissioned, starting some 20 odd years ago, to tackle loneliness and isolation. That was written into their aims right at the start, to do a range of health and wellbeing activities, to signpost and support people in what's a complex system, and to make sure that older people are at the heart of running that service. That's a model that increasingly people recognise is going to be the way to solve it. And of course, the 37 across the city, we fund them, adult social care and public health, jointly to the tune of some £2.3 million. We know they bring in a lot of additional money as well. We see them as being central to this. And what we'll be interested in doing is how we can learn the lessons of neighbourhood networks and apply that to some other groups as well. And I think you'll see the neighbourhood networks broadening out the sort of some work they do in this area. And then social capital, that's that sense of belonging that you have in communities. And I'll just pick out some of the highlights. At the heart of this is volunteering, and it's sometimes because of the state of the council and the shrinking council, it's hard to talk about volunteering if that's somehow replacing it. It's not. Every bit of research about volunteering says it's good for you. It's good for your own health and well-being. It's clearly good for the organisations you volunteer. I'd argue it's good for communities as a whole. I think if you volunteer at your local luncheon club or a mental health day service, you are much more likely on your way home to call in your neighbour when it's cold, or to spot a wheel bin's not moved. So by building up on volunteering, you get a much stronger community. So in social care, we've transferred a significant amount of our staff budget to volunteers. So if you're volunteering Leeds now, there's a whole range of training you can access. We really like the idea of reciprocity. Volunteering is not just a one-way street, you get a lot out of it. So formal things like time banks, that was one in Garforth done, but developing one in Hyde, we see as a great way of doing that. Peer support, I was talking just now about the men's group that are delivering at Bothwell Live at Home, the fact that you get people themselves to support each other. The CCGs are doing lots of social prescribing, making sure people in GP practices can signpost people to this sort of support. Community brokerage, shifting the traditional social work function out of us sat in Merrion or even in an area office to actually having that thing sitting in small community organisations. And I'm just going to pick up 2 slides about the next bit. I don't have time to really talk about this, and again, a bit more jargon, asset-based community development. This is a piece of work that recognises that in community you have both physical assets, buildings like this, but you also have key people as well. And this is a community connector model. We've just been piloting it in Calvary, Hare Hills and Middleton. It's been really interesting. And what the people there have done is find key people in the community who are well connected. So I'll just have one of my favourites. In Middleton, they found a retired parks attendant. And what he does now, he gets a group of people, on one day of the week they walk around Biggie Woods, and knowing his knowledge of the woods and stuff, they pick up old branches and that sort of stuff. And it turns out this guy's a whittler, he can carve wood. So a second day of the week they go back to he's apparently got quite a big garden shed. They go back to his garden shed and they whittle them into walking sticks. And then the third day of the week they take those around and they take them to things like neighbourhood networks, data centre, that sort of thing. And so that's brought together a group of people, mostly men, so it's been a real change because they're often hard to engage, who are now beginning to form their own friendship groups and support. And what's interesting, that model, the men doing the group at the end, don't know that this is a social care project in the slightest and never need to know. It's about just doing a bit of support to try and include all those friendship groups. They've set up a poetry group in Hare Hills on the back of it. There's a really great coffee morning going on in Pudsey. There's a pub landlord in Calvary working with single men. We see that as being very much a direction of travel. Leeds is going to be massively helped out in this agenda as we were successful in bid for £6 million from the lottery. That's now led by Leeds Older People's Forum, so all that money is controlled by older people. They're just in the process of working out where that money is going. There's a series of workshops. So if you're in a group doing some work on loneliness and isolation, now's the time, get all the Leeds Older People's Forum, put your ideas in. But the sort of stuff they're wanting to do is that catalysts, who are those sort of key people, a lot of potential on intergenerational work. Can they make those great connections? Richmond Hill are already doing a really good piece of work where they're trying to find a person on every street who's going to keep an eye on everybody in that street. We want to nurture some of those really tiny groups and see if they can grow a bit further, create that support, including digital stuff. I think there's a real challenge in this digital world. And on the one hand, older people are being left behind a bit, so we want to do something to catch them up. But actually, some of the people could really benefit. And we're doing one piece of work, for instance, with one group of older people about developing a Facebook for health and well-being, where you can start forming your own connections. And of course, all of this is being done jointly with older people. And I'm going to slightly cheat, while Councillor Mulherry's here. This sits in a wider agenda about Leeds wanting to be the best city to grow old. Councillor Mulherry is one of the executive leads on this agenda. And part of the structure from it is this. So this is taken from the World Health Organization. Leeds is a member of the WHO Age-Friendly City Network. This isn't about just loneliness, but I think if you look at the ambitions here, it's a way of thinking about it. So to become an age-friendly city, these are the areas you need to move on and develop, support. I'd argue if you get this right for this wider group, you're probably doing it for loneliness. But I think what's interesting here is community support and health services are just one element. What really matters is things around outdoor spaces and buildings, transport, housing, social participation, employment, communication. All those things are critical. So my last message for me is clearly there's a role for public health, social care, health and wellbeing on this agenda because there's benefits to people's health and wellbeing if we get it right. But the real solutions actually lie in communities themselves, not in services like ours. So what you come up with your tables is critically